I'm Dr. Jonathan Yang, and I'm a plastic and reconstructive surgeon. I specialize in disorders of the hand and wrist. So I did my undergraduate degree, a 4-year degree at the University of California at Berkeley. I went ahead and went to medical school in Philadelphia at Drexel University for a 4-year degree. And I did my residency in general surgery and plastic surgery for 5 years at The Ohio State University in Columbus, Ohio. I went on and did a 1-year fellowship in hand and microsurgery at Baylor University in Houston, Texas. One of my favorite disorders to treat is carpal tunnel syndrome. And these patients with carpal tunnel syndrome always complain of burning, numb pain that wakes them up at night and they can't sleep. What I really like and enjoy about this procedure is it's a controlled procedure, it has predictable results, and many patients, if not most patients, feel relief that night of the surgery. Another routine, common disorder I see are patients that complain of their finger getting caught into their palm. It's painful, it causes a deformity, and they have to snap their finger outwards to keep it from catching and locking. It's known as a trigger finger. There's also a very easy way to fix the trigger finger. It's a less than 5-minute procedure that increases the tunnel space that the tendon glides through. Patients feel better, their pain is gone, and there's no more issues with them moving their hands. It makes them feel much better immediately, and I just feel such a great satisfaction from being able to treat patients and give them back their life. Another procedure I routinely perform is excision of a ganglion cyst or a deformity that's usually on the front or back of the wrist. The deformity is a painful cyst. It's also an easy surgery. It's less than 10 minutes. The entire cyst is excised down to the joint space, and patients feel immediately better. Now, I think something that's nice about being a plastic and reconstructive surgeon is every single incision I close, I try to minimize the amount of scarring present. So I close every single patient's incision like I would a cosmetic patient, so it's the most aesthetically pleasing as possible. Right when I came to Phoenix, I knew that I was going to live here and stay here forever. It's one of the most beautiful, scenic, wonderful states in the entire country. The moment I came here, I knew I would be living here for my entire life.